Question number 1, which laser machines do you recommend to perform this type of treatment? Sub-question, which laser diode is best suited for this, and what wavelength is safest in procedures desired results? How about we stop there and see if that's something you can handle, and I'll come back with the rest of it.
Absolutely. As far as the evidence-based research and all the history of what we've seen, I would say that the CO2 laser wavelength is the optimal wavelength to perform this procedure, based on all the science we've seen over decades. I think you mentioned diode there. You could not perform this procedure with the diode laser. Penetrates way too deep, creates too much heat, and it can't be delivered through fractional. So it would be the CO2 laser would be the ideal wavelength to perform this procedure.
Great, thank you. I think you may have covered this in your talk, but the final parts to this long question is, does it require multiple sessions, or could it be done in a single session? And how far apart between sessions?
Yeah, again, CO2 laser technology right now, the data that we've seen is a single session gives us a very nice result. Over time, people are looking at doing retreatments on an annual basis of a single session. And that's with CO2. If you are using an erbium laser technology, you would have to do multiple sessions. The cases that we saw earlier, sessions were done about every 2 weeks. Okay. Gordon, I don't know if you have any comments there. Is that fair?
Yeah, that is fair. I mean, it's the CO2 laser is the optimal wavelength for treating the soft palate. So, and typically you can do it in one treatment. So that's the right answer. The erbium doesn't quite penetrate as deep enough.
Okay, thank you. Now we've got a question of many parts again, male versus female. Let's do it in parts. So any difference gender-based?
No.
No.
Smoker versus non-smoker, any difference?
Well, no, it's not,
No.
Difference in outcome, no, but no difference
Okay.
in treatment, no.
Okay. Remembering that you're speaking to Ontario dentists, there's this big cloud over us called the Royal College of Dental Surgeons. Are you aware of any opinion they might have about this course of treatment?
No, I mean.
Okay. But we love short answers about the college. That's great. This may not be a fair question for Ontario. Is there a billing code for snoring treatment? I presume it means laser snoring treatment. I'm not aware of any.
It is a cash-based service.
Right.
Yeah, that's right.
And that's it. I take it all through the States as well, right?
Yes.
Okay.
Yeah.
Okay. It's always good to get this question, which says, great presentation, Chris. So knowledgeable. Thank you very much.
Oh,
So that's just a kudo to you.
thank you.
In terms of affordability, is there a laser in existence that allows you to turn a dial and get the benefit of different wavelengths for different procedures? Kind of like turn the dial to 5 and get French fries sort of thing?
Yeah.
The only
We wish
thing
there was.
Yeah, the only thing you can't change is the wavelength. But, there is a whole plethora of procedures you can perform with these devices over and above snoring, which is what I tried to show in the last couple of slides.
Yeah,
Okay,
pretty much most of the procedures you can do with this carbon dioxide laser, a good 95% of the procedures. So it's pretty multidisciplinary.
Okay. Okay. I don't know if is this an ER or YR laser? ER or YR?
Yeah, that's a erbium or a erbium chromium laser. No, this is a carbon dioxide laser. So this is a gas laser with the higher end of the electromagnetic spectrum. So it's not an erbium laser. The erbium lasers, what Chris talked about a little bit, is a different wavelength that it's a little bit more minimally. It would take 2 or 3 or 4 procedures to do what the CO2 laser would do in one. So it's a carbon dioxide laser. Yeah.
And what does YR refer to, Gord? YR?
Go ahead, Chris.
No, it's not.
Is it nothing? No, just
I think
pass
the
over?
person was probably asking, is it erbium or perhaps erbium chromium?
Erbium chromium. Yeah.
That's probably
very
what
close
they mean.
to erbium. Yeah.
Okay. Next question, can you please go over the penetration power once again? I was under the impression that erbium has higher absorption in water than CO2, hence deeper penetration.
Hang in there. You've got that half right.
Yes, yeah.
Okay,
Absorption, difficult to do this, but think of this concept. Absorption is inversely proportional to depth of penetration. Erbium is higher absorbed in water than CO2, but that means so much more energy is absorbed, the photo all turns to thermal very shallow in tissue because it's better absorbed. So within, 20 or 30 microns, all of the erbium energy is absorbed in the water, and that's where it stops because it's better absorbed. Because CO2 is not as well absorbed in water as erbium, it has the opportunity to stay light and go a little bit deeper before it's fully absorbed. So they are right that erbium is absorbed better in water, but there's an inverse relationship between absorption and depth of penetration. So because CO2 is not as well absorbed, it does go deeper. That's why it goes deeper.
okay, that's great, thank you. Is it important to limit scatter, and how is that accomplished?
I don't find it overly important. It could lead to perhaps even a better effect, but there's not a lot of scatter from a collimated beam of a CO2 laser, that's for sure.
Okay, Gord, anything else you want to add to that?
Well, in terms of scatter, it depends on the tissue that you're working with and the wavelength. And like Chris explained in his lecture, you only see scatter when you're firing on tissue that it's on the absorption characteristics. So, for instance, like when he was showing you that firing green onto red, it's absorbed. The erbiums and the CO2s are absorbed in water, so there's no scatter there. So it's really something that it's not a concern with CO2 or erbium wavelengths. You get very little scatter at all.
Okay. You got to know, this question was coming up. What's the cost of a CO2 laser, if you feel comfortable telling us?
Sure, sure. The lasers obviously come with the different attachments, but they range from $50,000 to $70,000. And typically, what practices do is they lease them for $1,200, $1,300, $1,400 a month, and they pay the monthly lease. And as Chris showed in his ROI outline, you're generating $7,000 or $8,000 in extra income. So the $1,300 isn't that big of a deal, but they range between 50 and 70,000.
US or Canadian?
Canadian.
Wonderful. Okay, good. More questions are coming in here. This is great. Will ablative fractional laser therapy regenerate mucosa to gingival tissue on edentulous ridges?
I would say yes. It doesn't matter where the mucosa is, if that's if
Okay.
that's the question. So yes,
Gordon,
scientifically it should happen. I don't know that it wouldn't happen anywhere.
Okay.
Yeah, I agree with what Chris said there.
Okay. Is the CO2 laser the one you'd prefer to use for a lingual frenectomy release, given the blood supply being close by? CO2 for lingual frenectomies, tongue-tied patients.
Yep, the CO2 works perfect
Yeah.
for tongue-tied patients. It's
Okay.
very quick.
I would say yes.
Yeah, absolutely. There's probably thousands of users out there, and they use it on frenectomies all day long. So yeah, it would work very well.
Okay. I just lost my place. What do you think of the Solea laser, SOLEA, and is there a cheaper option? Solea or Solea?
Yeah. Very expensive.
Okay.
I think it's about 100.
The answer is yes, there is a cheaper option.
And you
Yes.
sell it, right? And you
Yes,
sell it.
we do. Yeah.
Yes. Okay.
It's an expensive laser. I don't know. I think $130,000 or $40,000, and it's a CO2. It's the same technology, but it's very expensive.
Right. Someone's just typed in 200 here for me.
Yeah, it could
Uh,
be 200. I don't even know.
Canadian, sounds a little high, but.
Now, can you provide evidence-based research papers? This could be something that you could send to Bianca and we could distribute, but I'm sure you have lots of
Yes.
research papers that we could share with our members.
Yeah, I had a lot of little fine prints, which most people probably couldn't see in the presentation tonight.
Right,
But anytime I was making a relevant claim, it was referencing a paper. So I can send some stuff along to Bianca if you like.
That'd be great. That'd be great. Oh, this is a good question. Do you have testimonials where patients stop wearing their CPAP or their dental sleep appliance after receiving these laser treatments?
We'd have to reach out to our database to all the dentists who are doing this, but hey, Chris, I mean, all the dentists throughout North America, well, worldwide, that are using this technology, I guess you'd have to reach out to them and see which ones have the testimonials.
Yeah, I'm sure they do. I would have to take that away as a to-do item, and I can ask again, Bianca, I can follow up with you on that. I don't in my database here, but I'm sure they do exist.
Right. I think when we first connected, Chris, I got from you the thought that this was an adjunctive therapy, not necessarily aiming to eliminate or replace either CPAP or dental appliance. And I think what I heard from you tonight is we're just going to expand the airway and make things more effective and perhaps lower air pressures and not have to advance the mandible. But yeah, if you could find some evidence on that, I mean, that would change, well, in dollars and cents, it probably wouldn't change a lot. We in Ontario, as you probably know, our biggest problem is fighting the almost free cost of CPAP through the medical system versus paying dentists like myself 100% for everything we do. So it's often a problem getting folks to not go the CPAP route if it's truly dollars. But if we could avoid either one and have laser treatment, that would be even more helpful. So if you could come up with that, that'd be great.
Right.
I'll take that.
As a beginner in this field, which academy would you advise us to join to learn more? This is obviously about laser.
Right. Right.
What do you think of the ISLD, International Society for Laser Dentistry?
Yeah.
They have a conference coming up in Egypt.
Right. I mean, all these, there's, probably 4 or 5 academies of laser dentistry out there of some kind. And they're relatively decent. I mean, we pride ourselves at the ILD of lecturing on all laser wavelengths and technologies. And one of the nice things that we do is we have a variety of courses, from evening programs to one-day programs to 2-day certifications to chairside programs. So, you can work on the evening program and then work your way up to the other events, which I think is very helpful. But to answer the question, I think all those other societies are probably pretty good as well.
Absolutely. I mean, there's the speakers that speak at our conferences also speak at other conferences. So you just got to pick someone who has knowledge and experience in this field.
And you're going to want to work with an organization that can help you and your staff at your facility, not just you flying to a course, where they can come and do some work with you and teach your staff and do some chairside with you. So that's very important.
I don't think you've even given us your website, Chris. Is that something we also can ask for? Because I'm sure that would answer all the specific questions people have. You've got your email.
You can, and I can forward it to Bianca. It's the name of the company, Institute for Laser Dentistry. So
.com or .ca or
.com.
Okay.
Yeah.
Well, that'd
I'll
be great.
forward that formally so you can have that on the site and people get, the spelling correct, etc.
Absolutely. Okay.
We do this for a living, and we have for many, many years. We live and eat and breathe laser technology. We do come to customers. If somebody would like a one-on-one, either webinar, Zoom, or follow-up meeting in person, would be happy to do that. It's a challenging subject to go through the detail in a short period of time. So a conversation afterwards, which is when all your questions come up, that would be wonderful. We are based in Toronto and we do travel. So we'd be happy to do things virtually, remotely, and help you out. I think, as Gord said, probably our greatest benefit is one-on-one chairside. So not only in helping you decide whether this technology is right for you, but if you make that decision, working chairside with you on technique and operational characteristics, educating your staff and helping you educate your patient base is a big part of what we do. So would love to have that opportunity. Email here is probably the best way to get a hold of me. I have people monitoring it for me and be happy to get back to you in any of your requests as soon as possible.
But you have a training center of sort in Toronto, right? Or at least an office where people could go as well?
We do most of our training, but we do most of our training by bringing it to you. So either in your office or, we do everything from lunch and learns to sessions 101 for small offices if you want. We also do training across the country in hotels. So we'll do, we'll have a one-day training session in a hotel that's convenient for everyone to get to. So we do it across multiple different venues. So it's not necessarily a matter of you having to come to us. You can come to us if we do a Toronto course, let's say at the Marriott, or a Calgary course at the Hyatt. But we also come and we bring the training to you if that's more convenient.
Right. Thank you. We now have a raised hand from Dr. Paul Alter.
So there was a lot to follow, and I've been interested in lasers for a long time, but just couldn't find anybody around who could teach it. So I'm surprised I didn't come across you folks. So what's the wavelength of this laser?
10,600 nanometers. So
Okay.
it's the same laser that the dermatologists and plastic surgeons use. And we've been using dentistry for a long time.
So when I was looking at lasers, and it was primarily to do troughing around abutments for crown and bridge for taking impressions. So I came across because one of the offices I visited had something called Blue Wave, and it was a diode laser. Is diode a certain wavelength, like around 800, and CO2 is different from diode? Or how is all this nomenclature? What does it mean? Can you give us a little quick talk on that?
Yeah, I mean, diode is when you think about lasers, diode is many wavelengths. So basically, they range from 445 up to 980. So there's 810 diodes, 980 diodes, 445, different wavelengths, which do different things on tissue. And the diode lasers are typically soft tissue lasers, which are good for vaporizing and coagulating, and they work very well. But if you want to do more procedures like what Chris was talking about, snoring and whatnot, you got to really reach out to the far end of the spectrum and get those higher wavelengths. So you'll see diode lasers pretty much on many dental offices because they're small and inexpensive, and they're good for for doing some soft tissue procedures. So but there are different types of diode lasers, not one wavelength does all.
So is the CO2, can you lower the wavelength so you get into the blue wave machine spectrum, or it doesn't work like that?
No, the wavelengths are just one wavelength.
Just one wavelength.
The most versatile wavelength is the CO2, because it can do so much, as Chris showed you in that slide. So it's the most versatile of the dental lasers.
And what do you do about sterilization and all that kind of thing?
Of the device?
Well, of anything that's going to be touching my glove or into the mouth.
Yeah, you can autoclave it. You can steam sterilize it. All of these hand pieces are detachable. So you just take them off.
Okay, does it have a tip that you put in and you have to touch it to something blue and all that?
No, not the CO2 laser. It's actually a free beam technology, which means you don't have a tip or a fiber. You actually use a concentrated beam of laser light, even if you're doing surgery, if you're vaporizing tissue, if you're troughing, for example. Now you can get tips that also fit into handpieces for the CO2 laser, and you can just bag them and autoclave them. So a
Yeah.
variety of different ways you can deliver the laser energy.
If you're doing
And what-
perio, you put a tip on it, which can be autoclaved.
And what about calibration?
Calibrating the laser.
Well, how do you know? I mean, after a while, does it not lose anything?
Yeah, no, I mean, it's self-calibrated. In other words, there's an internal power meter which constantly calibrates it, and it get so that you know exactly what the energy you're getting at the distal end of the articulated arm and the tip. But like any technology, any laser, all lasers, you know, once a year, what we do and what most companies do is they have a technician come and just do a preventative maintenance on your laser for an hour or two, just to check the calibration. But they're self-calibrating.
Okay, thanks very much. Nice presentation.
Thank you.
Thank you, Paul. All right, so it might be appropriate to thank these gentlemen publicly again for an excellent presentation, lots of technical information.